to Cancer 101, the fundamentals of cancer. So this is the second part of a video on pathology reports. Please have a look at the earlier one. I'm going to continue with the same pathology report from that first video and just finish up discussing that, a few more phrases and words that are in there that are important to know. And then we'll look at a second pathology report for an unrelated tumor. So looking at the pathology report that I just put up on the screen, again, this is the one from the first video I did on pathology reports, or path reports as they're often called. You'll see in red down near the bottom, resection margin positive for carcinoma. Now, resection means a surgical removal of something. So they're talking about some tissue that was removed from the lung. And they're talking about the margin of that resection. The margin means the very edge where the tissue was cut. And it says it's positive for carcinoma, in other words, positive for cancer. Carcinoma is essentially another word for cancer. And what they're saying there is that when the surgeon removed the tissue, the surgeon did not get a clear margin, meaning he did not get sufficient healthy tissue that's past where the cancer had grown in order to be safe. So if the margin, the resection margin, the edge of the tissue, in other words, has cancer in it, it means the cancer probably continues to extend past that margin. In other words, it's still in the tissue that was left behind when the surgeon did the surgery. And so typically they don't want to see that, of course. They want to see clear margins, and they don't want to see cancer in the margins. But cancer is a cellular disease. Now, when millions or billions of cells clump together, then you can see them as a tumor. But oftentimes you can't see small amounts of cancer that are running this place and that place. You would need a microscope to see them. And so this is just, unfortunately, an occasional event where the surgeon, he tries his best to get all of the cancer, but it turns out a little bit of the cancer was left behind. Now going down below, just below that, in blue, you see they're talking about lymph nodes. Now, 1 out of 5 of the lymph nodes was positive for adenocarcinoma. And again, adenocarcinoma is the common type of lung cancer that we were talking about here, called non-small cell lung cancer. So basically they're saying 1 of the 5 lymph nodes had cancer in them, but notice it says by direct invasion. This is an additional note where they're saying this is a different way for cancer to spread. They're noting that clearly. Cancer often spreads by the lymphatic system or by the blood system, where little clumps of cells break off and they go through the bloodstream from the lung in this case, since we're talking about a lung cancer. And maybe they spread to the liver. In other words, they take this long and difficult journey in the bloodstream, which is not easy to survive for these cancer cells, but they eventually manage to get to the liver. They take up shop in the liver. They develop blood vessel because they need nutrition, of course, and they eventually start forming tumors in the liver, and that's called metastatic cancer or distant metastasis. But in this case, it's different. What the pathologist there is saying is the cancer actually spread by direct invasion, but basically the tumor pressed up against some lymph nodes and actually invaded the lymph node that way by direct pressure, sort of eating into the lymph node that's there, to use a non-technical term, instead of small cancer cells spreading and eventually ending up in that lymph node through the lymphatic system, for instance. And so that's one of the ways that, one of the 3 ways that cancer can spread is by direct invasion. The tumor literally pushes into other tissue, and the cells are able to transfer themselves directly into that other tissue. One other note I'd like to make is 2 lines above where I underlined in red. It says greatest tumor dimension, 1.2 centimeters. So in cancer, tumors, of course, do not come in perfectly spherical balls. They are odd-shaped structures, and they are 3-dimensional. And so they typically will give the 3 dimensions of the tumor that they've resected or removed. And it might be something like 10 by 6 by 5 centimeters. In other words, in the 3 different axes, X, Y, and Z axes, so to speak, those are the measurements. What they're interested in is the greatest dimension, in this case 10 centimeters. The other ones don't really matter that much. They're going to base your staging on the greatest dimension, and that's why in this report they say greatest dimension of the tumor 1.2 centimeters, because that's what you're going to base your staging on. Okay, now I'm putting up a different pathology report. You can see it looks different. That's because, you know, every healthcare system or hospital or pathologist, they have their own forms that they own way that they fill things out. So you see at the top, surgical pathology report. The clinical history on the upper left there says large gastric mass. Gastric refers to the stomach, and a mass means, you know, a tumor of some sort. By the way, tumors and masses can be cancer or not cancer. So just because this is mass or tumor doesn't necessarily mean it's cancer. They would have to say it's a malignant mass or a malignant tumor to mean that it's actually cancer. So this was a tumor removed from the inside of someone's stomach. And you'll notice in the diagnosis, this is stomach partial gastrectomy. Gastrectomy means removal of the stomach, and partial means a partial removal, so they didn't remove the whole thing. And then it says in the next line, underlined in orange there, it's a malignant epithelial gastrointestinal stromal tumor. So a gastrointestinal stromal tumor is often called a GIST, G-I-S-T. You'll see it written that way many times. Now, this is an unusual tumor. It's typically very curable. Many people might call this a rare cancer. I often hear patients, you know, they would say, oh, I have this rare cancer. And it turns out that it's not particularly rare. It might be an uncommon cancer. Rare cancers are another thing altogether. Well, I'll talk about those in another video. Notice on the next line, underlined in sort of orangish yellow, it says tumor size 10 by 9 by 8. And this goes to, again, what I was just speaking about a few minutes ago. The tumors are 3-dimensional. They're not perfectly spherical, so they have different measurements in different directions. And in this case, the only measurement that really matters is the fact that the largest dimension is 10 centimeters. And they're going to base staging, assuming the staging does base itself on partially on tumor size, then they're going to base it on the 10 centimeters, and the other measurements don't really matter. Now, next thing up is down in the middle, encircled in green, it says gross description. Now, of course, this is tissue surgically removed from a person's stomach. It's a big cancerous tumor, and so in a sense it is kind of gross. But in this case, gross doesn't mean that. What it means is a large description of the large mass or the tissue that you can see by eye. In other words, it's, if you look down below in green also, it says microscopic description. A gross description is what you can visually see, what the pathologist can visually see just looking at the tissue. So first they describe that, in other words, the color and what it looks like. So basically, gross description means what you can see with your own eye without the use of a microscope. Notice in yellow, a few lines down, I underlined the word encapsulated. It says the mass appears to be encapsulated. So tumors often are encapsulated, meaning they're enclosed in a sac. And so if you can get a tumor that's essentially enclosed, the body has sort of closed it off in a sac, then if you can remove that, you know, hopefully that's a good thing. It's sort of like you're getting the whole cancerous tumor by removing that encapsulated sac. Next thing down is the microscopic description. Now, in the microscopic description, there are lots of things in there that really are not that important. I mean, they may be important, but they're not particularly important to you. They're very technical. They're very hard to read and understand. And so, you might want to read through it and try to pick out a few things that seem to be important. Here I just underlined one in purple. It says a few areas show foci of necrosis. Necrosis means dead tissue, and foci mean focal points or areas of dead tissue. And so what is necrotic tissue, or why is there necrotic tissue in the tissue that they removed? Well, typically what happens is cancer cells grow very rapidly, and in order to grow, like anything else, they need a food supply. They need to develop, they need to use what's called angiogenesis to develop a blood supply. They literally send out signals, the cancer cells, saying, please bring some blood vessels over my way so you can feed me. And because they're growing, they absorb a lot of energy. They need a large blood supply. But they're growing so fast and piling on top of each other that a lot of times they simply can't get enough blood supply fast enough. And therefore they die. And so then you see areas of dead tissue because it's basically cancer cells that have grown so quickly that they can't survive themselves. Now, other cancer cells, unfortunately, continue to survive and grow. Other necrotic reasons for necrotic tissue might be that the tumor has pushed into healthy tissue, but crowded it so much and squeezed off its blood supply and so forth that tissue, once healthy tissue has died. So there are a couple of reasons why you might have necrotic tissue, but that's what that's talking about there. So that's all for today. Again, I encourage you to get your pathology report from your doctor. It's yours for the asking. You don't have to be worried about asking for the information. They will give it to you. And there's a lot of stuff in there that is a little bit difficult to read, but nowadays with the internet, you can look words up, you can write questions down, underline things on the report, bring it into the doctor the next time and say, hey doc, what does this mean? Ask questions like, is this important? Is this something that refers to my prognosis or that will affect my best treatment options? Those kinds of questions, and the doctor can explain that to you. But keep in mind that a lot of the information is not particularly important, so try to get him to zero in on the most important technical aspects of the pathology report. I'll see you again in the next video.